All right, Linda, thank you so much for joining us on another episode of The Great Retention here at Children's of Atlanta headquarters. So thank you so much for joining us.
Thank you. My pleasure. Glad to be here.
Absolutely. So much respect for you as a leader, but also for Children's as an organization, right? The brand, the purpose, the mission. So I'm so excited to just dig in and just learn from the experiences that you've navigated, especially over these last few years. There's been a lot of challenges, right? But for our audience, talk to us a little bit about just overall makeup of Children's, number of employees, locations. What does that look like today?
Yeah, well, we've grown a lot. So we're at 13,000 employees and growing. And we have 3 hospitals and 8 urgent cares and many other ambulatory locations. So we're spread throughout Metro Atlanta, and so quite large. We have everything from physicians, nurses, respiratory therapists, lab pharmacy, food service workers, environmental services worker, marketing,
Wow.
finance, you name it. We have a lot of different types of employees, a lot of different generations.
Yeah.
And so our organization is very diverse.
Absolutely. I mean, it sounds like you're leading a small city. I mean, everything from, like you said, physicians to food services to security. And what goes into my mind is, I know that culture is really important, but, and I want to get your feedback on what does that mean to you as a leader, but also as an organization, but also, how do you keep that sense of culture when you have such a diverse employee base that's spread out all over, right? So talk to us a little bit about what that looks like and what that means to you.
Yeah, well, we take culture very seriously here. It really is the fabric of who we are. And we've been focusing on culture a lot over the last couple of years. And, it's been challenging for us. It's been challenging for everyone. So we decided to double down on our culture and really to define, what do we want our culture to be? And so we went through an effort in 2021 where we relooked at our mission, we updated our vision, we updated our values, we created an employee promise and a new strategy. And we brought all that together to call it One Children's. But really, the focus on our employee promise and our values is really what brings our culture alive. We committed to that. We rolled it out in early 2022. And we've seen an incredible payback from doing that and that focus.
Yeah. So I would love to dig into more of that. So it sounds like, you prior to that, here at Children's, obviously impacted by the pandemic, right, and COVID. And so coming out of that and not even totally out of that, then the leadership team said, hey, we're going to reevaluate our brand promise and mission and values. And so talk to us and where my mind's going. What I hear from a lot of leaders right now is they're talking about, what is our employee experience strategy, right? From hire to, to exit, everything in between. And what you just shared to me sounds somewhat like, hey, you're looking at your employee experience tied back to your values, tied back to your. So talk to us a little bit about the why behind why you felt that the organization needed to focus in this area. Talk to us a little bit about the experience. Would love to learn from you on that.
Well, quite frankly, like the rest of the world, everyone was just in a funk, and we just felt like, you know what, we need some energy here. We need to reignite the passion for what we do, why we're here. And so we really felt it was important to reevaluate our mission, which is to make kids better today and healthier tomorrow. And we felt like that's still who we are and what we do. We did feel like our mission or our vision was not as compelling. So we relaunched our vision, which in short is to do everything possible to make anything possible for kids.
Love that.
And, we involved our employees in that, and I think and our physicians, and I think it's something people can rally around.
Yeah.
We launched a new employee promise, and we called it People First, Children Always, because we know that if we take care of our people, then they're going to be able to take care of the kids. And our employees loved that. They loved this notion of people first. And then we added a fourth value. We now have 4 values: care about people, passionate about kids, dedicated to better, and the one we added was committed to self. And especially during the pandemic, healthcare workers really put themselves first and
Yep.
took care of their patients and did everything they could during a very tough time, and they didn't take care of themselves. And so it was us giving permission to our employees, you've got to take care of you. So we added that value of committed to self, and I think it ended up being really powerful.
I love that. On the way in this today, I think Wellness Wednesday.
Yes,
Right? I
it's
saw
Wellness Wednesday.
saw some workout clothes around. So just to kind of go into that a little bit further. So, so one of the things that that I hear from, especially in healthcare, is burnout is a real big issue.
Yeah.
Right. And this kind of goes into the work that I believe that you focused on for mental health, but I think it's tied back to, self-care.
Right.
Right. And so it goes to your value. And so I'd love for you to share a little bit more about, just one, what have you experienced at Children's related to burnout and mental health? How have you responded to that? Obviously with the fourth value, but I know that there's got to be more than just talking about values.
Right.
There's got to be action, right?
Right.
And so talk to us a little bit about the action that you've taken. What are some of the lessons learned? Just overall experience around that.
Well, particularly in 2020, we started to see not only our employees, but their kids really struggling with the pandemic. I mean, everyone's shut down, kids aren't in school.
Yep.
And so we started to see a lot of mental health bubble up. But what we heard was that parents could not find a provider because they were not in network. Everything was out of network, or the providers did not pay or did not accept insurance. And so we decided, you know what, we've got to do something. So
The mental health you're referring to.
the mental health,
Got it.
yeah.
Got it. Okay.
And so what we decided to do was to offer free mental health services for all of our employees and their dependents.
Okay.
And we still offer that today. So if you go to a mental health professional and they don't accept insurance, as long as you submit a bill, we will cover it free.
Okay.
100% free. And so we've now had that for this will be the 3rd full year that we're offering that. It has been huge. I mean, we had parents that were desperate to find mental health care for their kids, and now they just don't have to worry about that. There are lots of providers that are self-pay, but we're paying for that. So that's the biggest thing that we did. And each year we have about 15,000 visits to mental health professionals. And if you think about that, it's like a little over 1 per employee.
Yeah.
But especially for the kids. I mean, kids are really struggling as much as the adults are. So we wanted to offer that. We also have mental health counseling free on site. We introduced a number of programs, one, Tea for the Soul, where we'll go to a department and have tea and soothing music and really work with groups on meditation, stress relief. We bring a masseuse and do chair massages. So really just a lot of things to help our clinicians in their units where they are. So both at work and away from work, a number of resources to tackle this mental health issue.
That is so cool. And when I hear you, because I think for each organization it might look a little different, but what I hear you is you're basically saying to your people, we see you, we care about you, and we're taking steps towards you.
Right.
Right. And then with the idea that if from a leadership perspective, if we do that, they're going to take care of our kids, right?
That's
Our
right.
patients. So it all kind of comes
Yeah.
together, right? And let's take ourselves out of the healthcare industry for a second. Take care of our people. They're going to take care of our customers.
That's right.
Right. And so that's a direct relationship between employee experience and customer experience. And
That's
so
right.
I love how it all comes together here.
Yeah.
So, and I'm going to go tactical here for just a
Sure.
second.
Love tech.
So I'm just thinking with 13,000 people, Linda, I mean, rolling out a new mission, this strategy, that's not an easy task, right?
Right.
I mean, that there's a lot of planning, a lot of work goes into that. Would love to hear, I think previously we talked about there was a big focus you put on empowering managers and reinforcing this message with the managers so that they can reinforce it. Talk to us a little bit about tactically, how did you do this? How did the organization accomplish and achieve the goals around this?
Yeah, well, it is a big task. So where we started was we had an all hands on meeting with our top managers and above. So it's about 600 people,
Okay.
managers, directors, VPs, and we shared the new children's story, but we shared it in a way in stories, in vignettes. We had employees come and talk about what it meant to them, to our leaders.
Love
And
that.
so we really involved the front line in this leadership meeting for them to say, this is why I believe in this promise, these values. And so we brought it to life very creatively through video and presentations. We then said to all of our managers and above, we need you to cascade this down. And we gave everyone, a walk around deck, tools, resources. We created a children's story hub on our intranet so that managers could access those resources and make it available. But we did two other kind of unique things. We had something called a culture lab. Well, we brought that same group of 600 and above in different sessions together to have what we called culture labs.
Okay.
So we brought them together and we said, okay, how do we make this real? What are some challenges in our culture that we can solve? And they came up with a lot of different ideas, and we kind of treated it a little bit like a Shark Tank. We
Okay.
then had the executive team, they presented to us, and then we voted on which ideas we thought had the most merit,
Yeah.
and then we implemented them.
It's like you're funding,
Right.
startups
And
here.
so it was totally like
Yeah,
that. So
okay.
each of them, had a table, and they came up with they thought would help move the needle on our culture the most.
Okay.
And so one of those ideas was a concept called Leader Lean In. And we said, okay, yep, we'll sign up. So each executive team member adopted a clinical unit. So for example, I adopted the emergency department.
Okay.
And we shadowed in that department. We met with management team. We went to meetings. We really got to know that particular department deep.
Yeah.
And it was our way of showing, we really care about our clinical areas, and we kind of adopted them. And so now I feel like I'm a card-carrying member of the emergency department.
That is so cool.
Yeah, and so that was one of the ideas that came out of the Culture Labs. It has been so successful. Another idea that came out of there was to have frontline champions, and we call them culture champions. So it's a group of frontline employees that represent various areas in our organization, and we come together every other month. And I lead that group. We share information about what's going on with children's. We always start with the children's story and all of our culture elements and tie every topic in that meeting back to one of those cultural elements. They are then tasked to taking that information out to their colleagues, to their employees.
Yep.
And it's been a very successful way to get the word out from the front line. So it's kind of a top down and a grassroots up
And a
way
bottoms up.
to really make this culture part of the fabric.
I love it. One of the challenges I hear from other leaders, especially at when you have a large number of employees, is they'll put a lot of work into re-looking at their mission and values. Everyone's really excited, but then fatigue sets in.
Yeah.
Right, and you kind of go back to your baseline or your
Right.
norm. And so what I love about the culture group that comes together and the leaders leaning in is it tells me that it's how you make it sustainable.
Right, that's right.
And because you're learning too, right? Well,
Right.
how do you live this in the emergency room, right?
Right.
What does it mean when you
Right.
have, people who are coming in and you have to, and so those are real things that,
Right.
now they're knowing that you understand. So I love that. The other thing that I wanted to highlight that you shared was storytelling.
Mm-hmm.
So you brought these leaders in, and then you had these stories of the impact, I guess, that is being made in the community, and that makes it real,
Right.
right? And people relate to stories; they remember stories. So I love that idea, and I'm kind of speaking just from a leadership perspective, things that maybe I can apply to our team, right, or
Right.
other leaders can apply. So, but I love that about the storytelling, and because at Children's, the work that you do is so meaningful.
Mm-hmm.
Like, I don't want to lose sight of that, right? I don't
Right.
want to forget that, right? Hey, I get busy, but I don't want to forget that. So,
Right.
so thank you so much for sharing that. Next question, I wanted to just get your thoughts on. I can't believe that we're already looking at the second half of this year,
Right.
looking into even to next year. Are there certain things that you're looking at next? What are maybe some of the trends or some of the things on the horizon for Children's
Yeah.
that are on top of mind for you right now?
Yeah. Well, pretty exciting news is after a couple years of some struggle, our retention is really back to pre-pandemic levels, very, very high. And we just did an engagement survey, and those scores were extremely high.
That's
We
great.
were so thrilled. And so we're digging into that data to say, you know what? We're thrilled with that, but we need to keep improving. I think one of the things, particularly with the younger generation, that we're seeing is they want some flexibility in benefits.
Yeah.
Many of them are on their parents' healthcare plans until they're 26. So the younger employees, it's just not as valuable. And so we've got to try and find a way to provide some benefits that are meaningful to all generations. And so we're really looking at that for the years to come. What might we offer in terms of flexibility there? Obviously, we're always have our eye on being competitive with compensation. We're rolling out a number of leadership development programs for the level just below our managers, so more of our supervisor level, and we're excited about that.
Yeah.
So really staying focused on those things that employees say make a difference, which are recognition, career development, and of course their total rewards package.
Yep. Love it. Well, so Linda, thank you so much for just sharing your
Yeah.
your experiences, right? Your real world lessons learned. As we wrap up today, one of the things that we always try to do, we want to do for our audience is to leave them with a practical next step, an action that they can take and apply to their team. So, thinking, in a healthcare setting or not, or even beyond that, is there kind of a key takeaway that you can leave us with today that maybe they can go and apply to their team?
Yeah, I think one of the things that has really worked for us that I think has been a game changer is really leadership visibility. So leaders walking around, and that doesn't cost any money. Although if you want to walk around with some, treats or little trinkets, that is always accepted too. But
Yeah.
physically walking to people's spaces, having a little chat with them, and so. We just last week celebrated National Hospital Week, and we used it as an opportunity for all of our leaders to take, a half a day and just walk around and interact with our employees, talk to them, ask them how they're doing. And I just think that nothing beats, leader visibility and taking the time to stop and recognize every employee.
Yeah.
So I think that can go a long way.
Just taking and because schedules are so busy, and I think employees know that, but so just taking the time to invest in that person.
Yeah.
Love that.
Yeah.
Love that. And it doesn't cost anything.
Doesn't
Right?
cost
So
anything.
yeah, it's perfect. Well, Linda, thank you again so much for joining us on the Great Retention today. Again, just love the work that you're doing, love you as a leader, and just really appreciate your insights today.
Yeah, thank you.